Hello, my name is Jonathan Busco. Welcome to this series, To Err is Human, Why We Keep Screwing Things Up, and What to Do About It. This is part one, the introduction. It's all about why we're here in this place and time, why we're together. So, what's the point of this series? For quite some time now, I've been contemplating risk, error, and survival from a personal, corporate, and professional perspective. And so from that, I put together a presentation on error, which I have had the privilege of presenting in a number of different venues. One of the things I'm often asked is there a way for me to see the lecture again? And to this point, I haven't recorded it or presented it anywhere. Part of it is because I know that it would be an error for me to record a 60-minute presentation. That'd be very boring. So I thought about what's the best way to do this. And what I've done is I've broken the lecture up into a series of smaller lectures, smaller presentations. This is the first of them. How should you use these? Well, you could watch them all end to end, and then you get the basically same effect as if you were sitting in a lecture hall and I was presenting to you. That's one option. But I've broken them up in a way that they focus on a particular topic around risk, error, and mitigation. And with each of those topics, I've included some homework. Generally, it's the book or books or sources that I've gone to learn more about that particular topic. And so I'll suggest a reading and then also a thought experiment, a thought process, a homework assignment, if you will. Not that I'm going to grade them, please don't send them to me, but thought experiments for you to go through to see if you can apply what you've learned. So why am I here? Well, I'm an emergency physician, and for the first couple years I was practicing, right after I got out of residency, I had a colleague who would say to me, "You know, Jonathan, the medicine is easy. It's everything else that's hard." And I could not figure out what he was talking about because the medicine seemed really hard to me. What people complained about didn't make any sense. It was just nonsense. But after 3, 4, maybe 5 years, I realized that much of what I was doing from a medical, evaluative, and diagnostic perspective was pretty rote. It was algorithmic, and about 90% of the stuff I did, there was no variation on how I approached things and what outcomes I had. And that's a good thing. That's in emergency medicine and in most practice of medicine. The more you become an expert, the more you follow a set of algorithms and understand when it's important to deviate from them. So that seems straightforward. But my mom's a family therapist, and you don't grow up in that kind of household without learning something about your unconscious. So I did, and probably a decade or so ago, well, maybe 8 years, I began to think about, was I making unconscious errors in the evaluation of my patients? So what we see here is a spinal tap or a lumbar puncture. And in emergency medicine, if a patient presents with a thunderclap headache, a terrible headache that came on quickly, now everyone comes to the emergency department complaining of the worst headache of their life, otherwise why wouldn't they be there? But in this case, it's the sudden onset headache. That's the one that we worry about, something called a subarachnoid hemorrhage. Now, if a patient has a subarachnoid hemorrhage, we get a CAT scan of the head, and they're pretty good at picking up these subarachnoid hemorrhages, but in certain conditions, they can miss them. And in those conditions, even with a normal head CT, we have to do a lumbar puncture to figure out whether or not someone has a subarachnoid hemorrhage. Now, I like to think I'm pretty good at lumbar punctures. I've done probably 2, maybe 300 in my career, and I have a pretty good success rate. There's probably less than 10 that I have not been able to get. But it's not my favorite procedure because it seems like a lot of it's based on luck. You get the person all prepped, they're really skinny. You can feel their vertebrae. You freaking know exactly where you want to go. You put the needle in and you hit bone and you hit bone and you hit bone and you can't get into the canal. And then you get someone who is obese and you can't even find landmarks. And you say, yeah, I got to stick the needle in so that the interventional radiologist will say, did you try? And I can say, yeah, before they'll do it under fluoroscopy. And you put the needle in and it goes straight in and you get fluid. So I feel like there's an element of luck in doing these lumbar punctures to just make it an unsatisfying procedure. Anyway, I began to ask myself, am I biasing the way that I am asking questions and biasing my interpretations of patients' responses in such a way that I'm less likely to have to do the lumbar puncture? And this would all be unconscious. So I was thinking a lot about that. And about the same time, Life Flight of Maine was beginning its exploration into just culture. And I was fortunate enough to be involved in some of that process and some of that training, and started doing some other reading and realized that I didn't understand why people made errors and whether or not I was making errors. So that's why I ended up where I am now giving this presentation, because for the last 8 to 10 years, I have been contemplating the question of why do we make mistakes? So why are you here? Well, by the time we're done, I want you to be able to define risk and error, to be able to identify how our actual bodies are wired to create risk of error, and why evolutionarily it makes sense that we do that, and yet it causes or creates risk of error. We'll talk about cognitive biases and how they create risk of error. We'll define something called fast thinking and slow thinking and explain how they also create risk of error. We'll talk about organizational behaviors that lead to error or may lead to error. They create risk for it. And then finally, we'll talk about tools and techniques that mitigate that risk for error, that decrease your chances of screwing up. So what's risk? Well, Merriam-Webster defines it as the possibility of loss or injury, peril. So we think about physically putting something at risk. In some ways, what I'm really talking about is a statistical and methodological definition, which is the odds or probability of an unfavorable outcome. So a risk of an error is the odds of making an error. And anything that we do that increases that risk is a problem, and we want to be able to mitigate that risk. Well, what's error? I think James Reason, the author of Human Error, is probably the best place to look. Now, he's an industrial psychologist who has thought quite a bit about error, and he defines error as every occasion in which a planned sequence of mental or physical activities don't achieve the intended outcome, and when that's not just due to bad luck, some completely random chance, things run amok. Once you discount that, every time that things don't come out the way we plan, that's an error. And he breaks error into 3 types, which is a very useful taxonomy when we think about errors. And he breaks them into slips, where we have a plan and we fail to execute it the way we plan to. Now, the plan could be absolutely terrible. It could be the worst plan ever, but that doesn't matter in a slip. In a slip, we fail to execute it as planned. In a lapse, we just forget to do something, and that leads to an error in our execution. Just simply forgetting something, and it may seem like something minor, forgetting to wash your hands. That may not be a big deal in some occasions, but it's a huge deal if you're about to do surgery. And so these little lapses, these failures in memory, can lead to errors in how we execute a plan, and they may not even be things that people can see. And then finally, mistakes are those events where our plan just sucks. We come up with a bad plan or specifying how we're going to execute our plan, and we just do a lousy job. So whether or not we executed that plan well without slips or lapses, at the end of the day, we were guaranteed to commit an error because our plan was bad. So, your homework, if you choose to engage in this, is to read James Reason's Human Error. It's a good book. I won't say it's a fast read, but it's a good read, and it will give you a lot of insight into error and give you a good lexicon, taxonomy of error. And then once you've read it, I want you to think about some fiasco you've been involved in. And hopefully, whether it's personal or professional, at the end of it, you evaluated what went wrong and you thought about a remediation plan. Well, now I want you to think about that fiasco and your remediation plan. Knowing what you do after reading Human Error, would you do something different? Would there have been a different outcome in your post-event remediation? All right, I'll see you at the next presentation.